My name is Courtney Sayre, and my presentation is on hepatitis in Saudi Arabia. Viral hepatitis, including hepatitis A, B, and C, are distinct diseases that affect the liver. These viral diseases cause significant morbidity and mortality. Hepatitis is inflammation of the liver, most commonly caused by a viral infection. There are 5 main hepatitis viruses referred to as types A, B, C, D, and E. These types cause concern because of the burden of illness or death and the potential of outbreaks and epidemic spread. Types B and C lead to chronic disease in hundreds of millions of people and together are the most common cause of liver cirrhosis and cancer. Hepatitis A is most often transmitted through consumption of contaminated water or food. Certain sex practices can also spread HIV. Infections are in many cases mild, with most people making a full recovery and remaining immune from further HIV infections. HIV infections can also be severe and life-threatening. Most people in areas of the world with poor sanitation have been infected with this virus. Safe and effective vaccines are available to prevent HIV. Hepatitis B virus is transmitted through exposure to infected blood, semen, and other bodily fluids. HBV can be transmitted from infected mothers to infants at the time of birth or from family member to infant in early childhood. Transmissions may also occur through transfusions of HBV-contaminated blood and contaminated injections. A safe and effective vaccine is available to prevent HBV. Hepatitis C virus is mostly transmitted through exposure to infected blood. This may happen through transfusions of HCV-contaminated blood and blood products, contaminated injections during medical procedures, and other injection drug use. Sexual transmission is also possible but is much less common. There is no vaccine for HCV. Hepatitis D virus infections occur only in those who are infected with HBV. The dual infection of HDV and HBV can result in a more serious disease and worse outcomes. Safe and effective hepatitis B vaccines provide protection from HDV infection. Hepatitis E virus, like HAV, is mostly transmitted through consumption of contaminated water or food. HEV is a common cause of hepatitis outbreaks in developing parts of the world and is increasingly recognized as an important cause of disease in developed countries. Safe and effective vaccines to prevent HEV infection have been developed but are not widely available. The treatment for viral hepatitis depends on the stage and type of the infection. The standard treatment for chronic hepatitis C is a course of PEG interferon plus ribavirin for people with genotype 2 and 3, and PEG interferon plus ribavirin plus a protein inhibitor for people with genotype 1. These treatments have been shown to cure up to 80% of those infected with hepatitis C. Antiviral medication for hepatitis B includes PEG interferon, Epivir, tenofovir, and others. Since the vaccines were first developed, the hepatitis A and B vaccines have become part of the regular childhood immunization schedule and are not considered a routine adult immunization. The hepatitis A vaccine is usually given in 2 shots, and the hepatitis B vaccine is administered in a series of 3 shots. The most common side effects are redness, pain, and tenderness where the shots are given. Lamivudine is a drug used to treat chronic hepatitis B and works by decreasing HBV levels in the blood. It can also be used to treat infections caused by HIV. Ribavirin is used in the treatment of hepatitis A, C, and B. Ribavirin helps to bring down the liver enzyme levels. Oral ribavirin became FDA approved as part of a combination treatment for hepatitis C in 1998. Tenofovir is a type of antiretroviral drug which blocks reverse transcriptase, a crucial virus enzyme in HIV-1 and hepatitis B virus infections. Tenofovir reduces the infection rate of hepatitis B virus. Despite significant decline in the prevalence of HBV and HCV infection in Saudi Arabia, these viral diseases cause significant morbidity and mortality and impose a great burden on the country's healthcare system. Saudi epidemiology studies have shown that a hepatitis A virus seroprevalence in the country has reduced considerably over the past 2 decades. The graph shows a decline in the hepatitis A prevalence in Saudi over the past 18 years. The graph on the left shows prevalence of hepatitis B surface antigen among the Saudi population documented before and after introducing a nationwide HBV vaccination program over an 18-year period. The graph on the right shows changing patterns of HCV prevalence in blood donors at a hospital in Saudi Arabia over 20 years. Many infections are acquired in the healthcare setting. Noncompliance with the recommended infection control measures by the healthcare professionals play a major role in the transmission of HBV and HCV viruses in hemodialysis wards. A case study from 1995 showed Saudi Arabia to have the highest value of positive anti-HCV worldwide at 68% in hemodialysis patients. In a study from Saudi Arabia, by utilization of these recommendations, no new cases of HCV was found in a period of 2 years. Another study conducted by a public health specialist found needle stick injuries to be common in Saudi Arabian hospitals, emphasizing the importance of injection safety awareness. The government provides health care to Saudi Arabians through the Ministry of Health, which is entrusted with the provision of health care for the kingdom's population. Preventative screening services are available in the healthcare systems. The use of premarital screenings worldwide is critically evaluated, including recent experiences in Saudi Arabia. Couples who undergo testing can be informed about the genetic risk and given options for reducing risk of hepatitis. The decrease in prevalence of hepatitis in Saudi Arabia is due to vaccinations becoming readily available and the government providing health care free of charge to citizens. Hepatitis is still seen in Saudi Arabia due to the lack of compliance with safety recommendations by healthcare systems.